Today, we're going to discuss one of the most important issues in America, healthcare. We're all concerned about rising healthcare costs, and in a challenging economy, it's more important than ever. At the same time, we all want to live well, right? A lot of people are looking for answers, looking for education and information about their health, and looking for ways to take better care of themselves and save some cash. Well, we found one company that's already offering the kinds of educational resources that people need. Here to talk about healthy living and healthcare cost savings are Karen Coker and Dr. Scott Josephs from Cigna. Welcome to the show.
Thank you very much.
Now, this is exciting to talk about. We're hearing about healthcare all the time on the news, but when we think of healthcare, we think of taking our little card into the doctor's office, paying that copay, and trying to get better. But we should really be thinking about trying to stay well, right, Karen?
Yep, absolutely right, Beth. Our focus is wellness. And Cigna is a health service company and not simply an insurance company. So we've put forward all types of healthcare education and cost savings programs that people can take advantage of. Things like YouTube channel and podcasts on iTunes and a public education website that offers games and avatar-based learning programs.
I'm Doc Rock, teaching 5 steps to you to avoid H1N1 flu.
I love that this is so interactive. Now, this really struck my attention when I saw this, that you have YouTube in the podcast that you just mentioned. Tell us a little bit more about it.
Well, as an example, YouTube is a great way for people to learn, very interactive, engaging way. And we have a doctor, very entertaining doctor, who teaches kids, as an example, how to prevent H1N1.
Oh, wow. Now, having a resource like this, Dr. Josephs, I want to bring you into the conversation. Having something like this available is pretty important. How is this helpful for people?
As a doctor, I know that when people understand their health, they save money and they feel better. Many people don't realize that chronic diseases like heart disease and diabetes account for about 75% of costs. A lot of money out of your own pocket, right? But taking a few simple steps, eating well, exercising, getting enough sleep, is often the only prescription that many of us need.
Sounds pretty simple, as long as you know the right things to do. Now, coming out of the holidays, we're only a few weeks into the new year. People are stressed out about all the credit card bills, all the money they spent. A lot of people get depressed around this time of year. Is there something available for people who are dealing with those kinds of emotional illnesses that then become physical problems?
In fact, we have an app for that.
That's great.
We have an interactive tool that gauges your stress level based on your response to a few simple questions. So it's important to understand your stress by getting this score and then taking steps to prevent stress-related health conditions that it can predict in the next 12 to 18 months.
So it can help you predict just by going to the website and putting in the information. This is pretty interesting. Karen, navigate me through the website.
Sure, absolutely, because the website, to Scott's point, not only shows you what it is your current stress level is all about, what makes that up, but then it teaches you how to deal with it. And so we have a section on our website focused on all sorts of health resources for stress reduction, how to keep your New Year's resolutions. We have another section that's all about avatar-based games and other types of really cool, fun ways to learn. And then lastly, we have a quiz section, which you can basically test yourself on your knowledge of health. And more importantly, for all of your knowledge, you get to donate clean drinking water to underprivileged children.
Oh, wow. And all of this is free to everyone?
Absolutely. Everybody. It's available online all the time.
That's really amazing. I can't wait to check it out. Now, we're going to talk about this a little bit more when we come back. We're going to talk about some very valuable resources that you may not know are out there, like your own nurse line on call all day, every day. It's just a few keystrokes away. Plus, we'll talk about our kids and low-cost ways to keep them healthy as well. Don't go away. Welcome back, everybody. This morning we're talking about healthy living, educating you on healthy habits and ways to save money on medical bills in this tough economy. Joining us once again are Karen Coker and Dr. Scott Josephs from Cigna. I love talking about this. I mentioned a few minutes ago the on-call nurse 24/7. Tell me a little bit about this, Dr. Josephs.
Sure. We have a nurse available 24 hours a day, 7 days a week to answer your questions. For instance, let's take a mother whose child has a fever at night, and she doesn't know what to do. Should I call my doctor? Should I go to the emergency room? So our nurse can help her answer those questions or direct her to websites to help her.
That's great.
There are also, however, some people who don't want to talk to a live person. So you actually can prompt out to an audio-recorded library that has over 1,000 topics, each about 4 minutes in length, to help answer questions about nutrition, taking care of your health, dealing with a disease, etc.
So it can answer all of your questions.
Sure can.
Now, my next question, we're on the kind of tail end of the flu season. We're coming out of the flu season. Is it too late to get a flu shot? Should people still think about getting flu shots?
You absolutely should get the flu shot, not only the seasonal flu, but the H1N1, formerly known as swine flu, as well. Now remember, the flu shot won't always stop you from getting the flu, but it can reduce the severity of the symptoms, and it can also prevent more serious complications like pneumonia.
Okay, so we should still think about getting those flu shots. Now, we've talked a lot this morning, Karen, about this idea of healthy living, of staying healthy. How else can we keep our costs down?
Well, one of the best things that we offer via the website is Cigna Care Connections. And it enables you not only to figure out what is the right approach to take based on the situation you're faced with, but it also helps you find quality comparisons for hospitals and doctors and also cost savings comparisons. And so, for example, for your pharmaceuticals or for your hospitals and your doctors, you can look at what is the best, most cost-effective option for your area.
Oh, for doctors and for pharmacies.
Yep, absolutely.
And not only the overall cost, but your own personal out-of-pocket costs.
Now, that's a good tip to know. Now, of course, educating ourselves by going to the website and finding out this kind of information on saving costs is beneficial. Are there other ways to save? Is there more information to know?
Yeah, absolutely. One of the things that we learned early on is that personally, we all know we should learn more about health, but we don't take the time to do that. And so we are encouraging people by offering discounts and rewards. Oh. And so as an example, if you go out to the website, you can earn yourself, by participating in the learning programs, earn yourself some really great discounts for all kinds of wellness products and services, things like KinderCare Learning Centers, SportsAuthority.com, all types of things that will benefit you in your efforts to stay healthy.
So you are rewarding people for doing the right thing.
Absolutely.
It's great to hear that. Thank you guys so much for joining us. This has been really informative.
Good.
Thank you.
Thank you, Beth.
I appreciate you being here. Now, for more information on health awareness, you can find answers at Cigna.com/learn4your health.